Amazing. Good morning. Good morning, Monica. Good morning, mummies on the call. Good morning, everyone who will join later or is watching this at a later stage. As I know, a lot of you mums, parents actually are at work and might only find time for this on the weekend, and that's totally fine. Today is all about postpartum recovery. We'll go a little bit into what can I do to prepare as well for birth so that I avoid the major complications. We'll talk a little bit too about if that is, relevant to you about C-section recovery and the special circumstances around that. And we have the absolute postpartum recovery expert in the house, and I'm
Oh,
so grateful for you, Monica. I know your days are busy, and you're always our first port of call when we have complicated cases as well with our clients. So let's go into you introducing yourself and what Physio Down Under does for mums in Singapore. And yes, and actually you do more than mums now. You do babies and you do dads as
well,
well.
no. Yeah, but I will explain, not babies, but kids. Yeah.
Yes, okay.
Uh, so first of all, thank you so much for having me, Johan. It's such an honor. I always feel it's the one of our favorite things to do, Tamara and I, is basically educating and spreading the word and the knowledge and sharing with everyone. As you said, we are a busy practice, and we're so happy. When we first started, we had no idea that it would be such a successful
Yeah.
business. We're just having our sixth anniversary this week. I know it's really exciting. And we started, just Tamara and I, very small, and it grew. And we're now a team of six physiotherapists. And we used to just do women's health exclusively, but we have grown to encompass all of pelvic health for the whole community, which means we see men for pelvic health concerns, which include pelvic pain, bladder and bowel issues, erectile dysfunction. And then we also see kiddies that are 5 years and above, because they need to be able to participate and take on
Uh-huh.
the physio. So, and again, for kiddies, the main concerns will usually be bedwetting, constipation, incontinence as well. So, or issues with urinary and bowel concerns, as well as pain if they have any pelvic pain, which is a little bit more rare, but we do. And so yeah, we have a wonderful physio called Leah, who is passionate and very knowledgeable about it. So yeah, so for any parents out there with kids who are struggling, and they can be things like, they leak urine when they are on the way to the toilet, or when they jump on a trampoline, things that also happen with adults.
Yeah.
And many times is due to actually constipation that we're not aware. So yeah, so those are all the things that we're seeing. And with women, we see women across all ages, from teenagers to older elderly women. So through across all conditions, such as sexual dysfunction, bladder, bowel, postnatal, prenatal care, preparation for labor, preventing perineal trauma,
Mhm.
helping women postnatally with all sorts of issues such as bladder, bowel, pain. And that can include pelvic girdle pain, low back pain, wrist conditions. So across the whole rainbow, and then of course into peri and postmenopausal issues and vulval care and so forth. So yeah, everything. And
Amazing. I love that. And I want to preface this too by saying to you, whenever I speak to you and Tamara, it is always about you obviously see the difficult cases.
yes.
Before the pregnant moms who are going to join this call are getting all too concerned. I actually see a lot of births where we have no major complications, no tearing
Absolutely.
at all. There's obviously the pelvic floor is, I don't want to say takes a beating, but we are a little bit weaker due to relaxin and all of that. But it's not
Mm,
always, really complicated and dramatic. I think we see so much Instagram content or TikTok or whatever where it's all big drama and it's all, I can't hold my pee and I whatever, the big stories, the traumatic stories always sell the stories, they get the most clicks, right? But a lot of
Absolutely.
my clients recover without any, issues. But it is good to address the pelvic floor in pregnancy. As you said earlier, I love that you have this focus on also teaching moms how to push and how to engage their core when they do so, and to minimize the trauma down there. But so yeah, we're here to learn. We're really excited to have you.
Absolutely. And based actually just going on from what you just said, I think it's really important. And you're right. We do see the complicated cases, but we are more and more encouraging women to come as a preventative matter. And here's the thing is we actually understand that actually most women deal well with vaginal deliveries. It's actually a small percentage that have very,
Yes.
very complicated issues. But it has a lot to do with what we call the reserve that you have in your pelvic floor. So some women constitutionally can actually, or most women can deal with that huge event that
Yes.
is vaginal birth. So I think it's important to go in very positively, but we do also know that women who have a very good understanding of their pelvic floor, good coordination, understand how those muscles move, that actually they may help reduce, we now have good evidence to show that they may help reduce the length of their second stage. So the pushing stage can be reduced by understanding how to push more effectively and how to move that pelvic floor, how to let it yield around that baby coming down. So, and those are things that we can check and we can help women understand how to do during pregnancy. There's lots of wonderful imagery and tricks that we can get women to get some feedback and understand and confirm that what they think they're doing is the correct
Yeah,
thing.
yeah, I love that. And as a doula, I will add to that also not to be pushed into pushing too early, because we know that baby station plays a role. It's not just about dilation, but if that baby is still high and we start to push
Mm,
too early, we're really stacking the cards against us if we do that. So learning that as well and how the mechanisms of birth actually work. Anyway,
yes.
I will thank you for this introduction. I will ask you to
That's all
share
right.
now, and then we'll
Yes.
on the call. Feel free to, at any point, ask any questions if it's relevant to what Monica is talking about.
Yes.
We will have a little bit of time at the end as well for you to ask anything that maybe we haven't covered. And yeah, you can take it away, Monica. One,
Okay, yeah. So as you said, I'm very happy to stop along the way and answer any specific questions. But if you feel that when you want me to stop so that we have enough time for questions at the end, then just please do. And so I'm going to be sharing some of the booklets that PDU that we have put together at Physio Down Under that we share with our either pregnant patients when we're trying to educate them, and as well as our postnatal booklet. So I think as today we're talking more about postnatal. I will start with that booklet, and we will go through some of the main bits of advice that we give to women in terms of having a safe and smooth recovery of looking after their pelvic floor, perineum, their backs. So I'm going to try and start sharing the screen here now. Just bear with me.
And mummies, if in the meantime you want to put in the chat where you are in your pregnancy or postpartum journey, we'd love to hear that as well. So feel free to put it in the chat. And obviously, also you can put in the chat any questions that you have that I can then ask Monica for you, please.
Okay, so can you see the screen now?
Yes, and can I just say again, I'm so thankful that you put this together. It's been, a long time in the making, and we really need this. I give this to all my clients, and it's a really invaluable resource.
That's wonderful. Well, you basically pushed us to do it. So we eventually kind of got our act together. It did take us a bit of work, and I'm sure that we've probably missed a few things, and but at least we hope we got most of the information in there. So here we go. This information booklet is really intended to help women's recovery after childbirth. And this one we're going to cover we have a booklet for women who are going for a vaginal delivery, and we also have one for a C-section delivery. Now they overlap in some of the advice, but we will make sure that we get to the C-section one as well. Let me see if I can. Okay, can you see the screen all right there?
Yeah, absolutely. It's great.
Okay, so if we start on the left here, what we tend to advise women, and I'm sure that women who have a good doula and are having some good midwifery care would hopefully get some of these tips that we usually recommend at the hospital to think about. So if you've had a vaginal delivery and you are immediately postnatal, we usually talk about it in terms of the equivalence of almost having a significant ankle sprain, but in your vagina and your vulva. So you're going to have swelling and possibly pain, some lacerations, possibly some stitches. Even if you don't have stitches, that vulva, the labia will be swollen, and the perineum and so forth. So one of the things that we do advise in the first 48 hours is to just use some cold therapy. And basically that's more aimed at analgesia and comfort. So lots of different ways that women can do that. Easy ways is to actually, we have some examination gloves there. So in the hospital, if you haven't brought anything specifically for that, you can ask the nurses to fill up a surgical glove with some crushed ice. They usually have ice. I think so, right, Johanna, in hospitals?
They do, yeah, they do have ice. Otherwise, I mean, people can just get it from the petrol station around the corner. So there's always a nearby. So you could as well.
Getting a bit of ice. Usually, most wards will have some ice, and they can just fill up a surgical glove. You make a little knot at the top, and you can just apply that to the swollen vulva. If it feels too, and the surgical glove will be good because it's still clean, so then you can apply that to the vulva. Now, just making sure, of course, and it won't be comfortable to sit on top of that. So you just want to make sure that you're just in a semi-reclined position and applying that to the area. Again, I think a lot of people are aware of this, that when you first go for a pee, it can sting the area. So pouring a bit of water over the area with a squirty bottle can be helpful to dilute a bit the acidity of the urine so that it doesn't hurt as much. Some women also find it helpful to even just go into a shower or to sit into a bath, because that can help just relax those pelvic floor muscles and allow the urine to come out. Now, that's a very, very important point from a physio point of view. We always ask women to make sure that they can feel the urge in their bladder and that they can fully empty their bladder, and if they're not, that they must highlight that to the nurses. Most nurses in labor ward will be checking that that's the case, but we sometimes get that missed, and women go home with an inability to feel their bladder fully, and that can lead to problems. So we don't want to have urinary retention.
Okay, I actually have a question here for you, Monica, because as a doula, I see practices are very different from gynae to gynae with regards to how long a urinary catheter stays in after a mom has had an epidural, for example. Do you have any thoughts on that?
Look, I don't actually. I don't really know what the practice is here. I think the sooner it comes out, the better. But it depends on what the medical and the clinical situation is. So I think the doctor will have to make a call. So sometimes if the anesthesia is still too dense, the neurological connection with the bladder may have not set into place yet. So what happens is that they may remove that catheter, but that woman might still be unable to empty the bladder independently. So that's when, unfortunately, they sometimes have to recatheterize a woman so that we can make sure that that bladder is being empty. Does that make sense?
It does make sense, but I have unfortunately seen, clients where it wasn't removed for more than 24 hours. And
Yeah.
I thought that this is a bit strange. And
yeah, so I think ideally it gets removed as soon as possible. Because it improves, or sort of it reduces the risk of any infection, and it just allows the body to hopefully start kicking in. So my understanding is that we should really try and take that catheter out as soon as possible.
okay, amazing. And this is for all you moms here who are going for if you have an epidural or maybe you had a C-section, remind them of this, because sometimes they're so busy on this ward that they don't see who has one and who doesn't, and they might.
Yes, absolutely. I think it's a very valid point to question if they are keeping it in, to ask, is there a medical reason for you to keep me catheterized, or is it just that the ward is busy? And if it is, then I would push really strongly for them to go ahead and remove it.
Okay, amazing.
Yeah. Okay. So trying to make sure that we keep that wound area clean and dry to help the stitches heal. In terms of, it's a very normal symptom to feel heaviness in the perineum in those first few days. It does not mean you have a prolapse, okay? And this is something we can talk further along, but it is very helpful if you do feel a lot of perineal heaviness to use a well-fitted underwear. So something that feels, because sometimes the women take those disposable underwear and they're quite floppy. I don't know if nowadays we have better ones, but having well-fitted underwear and doubling up on sanitary pads can actually help give that extra compression. So if you think about my analogy of a swollen ankle or a sprained ankle, often you want to compress that swelling so that it helps to sort of, it helps with pain and it helps with swelling. So adding that extra compression can be really helpful. Did you want to add anything to that?
No, not at all. I find that, those loose pants, they're not very helpful, I find as well. And even a lot of my moms now buy these Freedom, the sort of granny pants, what do you call them? The really big ones.
And like we have in the picture there on the leaflet, something that goes right up even close to your bra level, because that will be helpful, as we will talk next about the support to the abdominal wall, which can be very helpful in the first few weeks. So Okay. Sorry, did you want to add any more?
No, I just said some of them are we just don't buy the right size, and then they're a little bit too loose, so they could be better fitted, I think, is what I see.
Yeah, exactly. So again, we do have some good evidence that during the first 6 weeks after delivery, using an elasticated, and I stress the word elasticated, postpartum abdominal support that covers your whole abdominal wall. So it shouldn't compress around the waistband. You should not have big marks around where your belly button area or waist area is. And the reason for that is if you've got still quite a stretched abdominal area and you have had a vaginal delivery, you want to be quite careful not to over compress that abdominal core area, because if we think about a tube of toothpaste and you squish the middle of it, you're going to have to send pressure in one direction. And so if we think about the core and the pelvic floor being now a slightly compromised, it's a little bit more vulnerable immediately postnatal, you don't want to put something that is a rigid material that will squeeze the middle, because that is more likely to send pressure downwards into the pelvic floor area. So I bring that, and I know that there are many very competent postnatal traditional massage ladies in Singapore who do the wrapping, but and some will do it really well. The main things to look out for is that as they do any wrapping, if that's what you choose to do, It should always be more supportive from the bottom up. So it should never be too compressive and too tight around the rib cage or the waist area. It should be a little bit looser at the top so that you're able to breathe, and that you should never ever feel like there is an increased sense of pressure and heaviness in your vaginal entrance or perineum. Okay, so that's a very important message to take away from this talk, and also just to make sure that if you do feel that way, please don't persist, just remove it and just put an elasticated one. So the research evidence, unfortunately, we don't have any evidence to say that the Malay more rigid material wraps actually help to reduce or to treat diastasis or pelvic organ prolapse.
Yeah.
So we want to be careful with what we choose to do. Our biggest advice is that don't do it in the first couple of weeks, if possible. If you want to try it, maybe just give your body a bit of a chance
Yeah.
to heal up a bit and go for that elasticated support, because it has a little bit more give, but enough that it can still give your muscles a sense of being held in space.
Yeah.
Does that, yeah?
There's actually a question on the chat now. What is the function of the postpartum wrap, and why is it better to use abdominal support versus none? And I think this is a little bit controversial, because I know that in Austria, Germany, German-speaking world, they've done away with the abdominal binders even after a C-section, because
Yeah.
you need to give that core musculature a chance to actually work and not be reliant
Yeah.
on that support. So I'd love to hear your support.
Yeah, so we very much, as physiotherapists, we very much try to stay on top of recent high quality standard research. So the most recent research update on this particular matter actually indicates that in terms of those, the healing of the linea alba, which is the central connective tissue that gets separated in all women as a result of growing, a baby inside their belly. And it's what we refer to as the diastasis recti, which all women will have a component of in the first few weeks postnatally, right? So the research now shows that supporting the abdominal wall with some degree of material that is elasticated, not rigid, can help give that abdominal wall some mechanical support that still allows a woman to access a little bit that core muscles, but not be completely unsupported in space. Okay. Now, we do know that that is only really helpful, the studies show, up until 6 weeks. After 6 weeks, and so that's when Mother Nature, in a way, is trying to heal the body, right? But it seems that women who do use some elasticated support seem to get to 6 weeks, and then we need to start working those muscles more actively. Okay, so we need to start then doing things like shortening the muscles by doing exercise, by contracting them a little bit more strongly, by doing proper strengthening. Okay, so by then, really, the research shows that we must not be using support, because you're then weakening the system. You're absolutely right. The brain, when it relies on abdominal support, on like external support, it kind of goes, oh, this is very comfortable, I'm not going to work those muscles.
Yeah,
But
exactly.
it does seem that there is a positive role to use that support in the first 6 weeks, when the body is going through a lot of healing, and it may benefit from that extra, what we call proprioception, which is
Yeah.
basically a sense of knowing where your muscles are in space. So
Mhm.
that is kind of the reasoning behind that. And then post 6 weeks, we really encourage women to not be relying on abdominal support.
Okay, that's great. And then, so if we use it in the first 6 weeks, should we be wearing it all the time, or only when we're up and or out and about, or what is your
Yeah,
recommendation?
very, very good question. No, I say to women, when you're upright and about and you're active, because again, all women, in the first week, we ask women to just, of course, don't go out and walk too much. Let that perineum and that pelvic floor heal. So don't go on any long walks. Stay around your house mostly, but walk around, move. You're going to be lifting your baby, lowering. So when you're doing activities like that and you're more upright, because gravity over time will just create a stretch in that collagen of your abdominal wall. So having a bit of that support in those first few days may be quite helpful. Having said all that, some women just don't like the support and they feel constricted, they feel restricted, they can't breathe. If you are like that, then I would say you're better off
Mm,
just staying
yeah.
without anything. I absolutely don't encourage women to sleep with it. I think when you sleep, you are lying down, your collagen will be able to relax. And in fact, as you sleep and rest, your collagen is actually contracting a little bit. So
Mm,
that's why when we wake up in the morning, the belly is actually a little bit flatter and a little bit smaller. But as we go through the day, gravity just drags on that collagen. And so by the evening, most women who are not wearing a bit of a support in the early postpartum stage will find that their bellies are like super stretched out. So that's kind of how it goes.
Okay, amazing.
Yeah.
Monica, we're never going to get through all of your booklet,
I
and we're
know. That's
going
okay. That's okay. So I'm happy to answer any
to
questions if they're coming up.
I know, but let's just share as much as we can. Mummies, feel free to ask questions on the call, sorry, on in the chat as well. And let's move on to pelvic floor
Yeah.
muscle exercises, because I think I give those to
Yes.
my moms the day the baby is born. And
Yes.
so I'd love to hear your recommendations there.
Absolutely. So we have very, very good evidence. Again, there's some really strong studies that have come out more recently to say that during pregnancy, women who exercise their pelvic floor, they actually have a better result with reducing their second stage and with doing better, having better outcomes for their perineum and postnatal pelvic floor. So we used to think there's quite a lot out there in the internet that says don't exercise your pelvic floor. So we are really, really pro exercising the pelvic floor. There's a caveat to that, though, that if you do have a very tense pelvic floor and you don't know how to relax, then
Yes.
there is a different approach to that. But women who have a healthy, normal pelvic floor that can move, and so it can squeeze and lift, it's able to hold. And when we give it the instruction to relax, it relaxes quickly and well, and you can feel that contraction go. So that's the well-coordinated, normal pelvic floor with healthy tone. That means it's not a very stiff, tight pelvic floor that can't relax. So for women with a healthy, normal pelvic floor, we recommend exercise during pregnancy. So postnatally, however, on day one, or actually week one, we don't want to work that pelvic floor to its maximal effort. We actually want to think of the pelvic floor in a much more gentle way and as a vascular pump almost. So what does that mean? We want to get circulation around the area, and we want to start making some connections between your brain and those muscles. So what we want to do is just do very gentle, like almost, in the airplane when you have to do your toe circulation
Yeah.
exercises and you're just like moving them up and down. That's kind of the intention with the pelvic floor in that first week postnatal. Your vulva and your pelvic floor will be swollen and probably a bit sore. So you want to just go really gently. Think about squeeze, then let it go, and squeeze and let it go. So gentle effort, I would say, like to a 20% or 30% of your maximal effort that you would have done during pregnancy. Now, for ladies who have had a C-section, that's different. Unless if they do a strong pelvic floor contraction, if they feel pain in their Caesar scar, then they should go lighter as well, because the pelvic floor has very deep and direct connections with the fascia, the connective tissue of your deep abdominal muscles. So women who have a scar immediately post C-section might find that it's actually sore to practice the strong pelvic floor contraction. So I would still encourage them to connect with that pelvic floor, but maybe go gently. And what's the purpose of doing that? Those gentle contractions, as I said, vascular pump, it's basically to help send some circulation to the area, to those swollen tissues, to help, it helps with the healing. It helps with reducing edema, which is swelling in the vulva.
Amazing. That is really good advice. I always say to moms, do it while you're feeding your baby, because then you remember to do it sort of 8 times a day, and just go eat.
Yes.
Just a couple here and there are good enough to start with. And
yes, absolutely, absolutely. I say to women, I have the following advice that I got from a very experienced physio in Australia, which basically is a little good tip to follow. You, on your first week, if you manage to get 10 contractions of your pelvic floor once a day, and just hold it, for, in the first week, it's gentle. So you just want to hold it for like a second. So you squeeze and release. Then by the second week, you just need to remember, okay, how many weeks is my baby this week? Oh, 2 weeks. I'm only going to try to hold my pelvic floor now for 2 seconds. Then third week, you can start increasing. Okay, baby's 3 weeks. You're going to hold it for 3 seconds each rep and release. And then fourth week and onward. So when you get to 6 weeks, which is usually when we tend to see women, we would hope that woman, when we examine her, that she's already managing to hold at least a 6-second contraction of their pelvic floor. So if they practice, even if they get it once a day, it is a massive bonus. If they manage to do it 2 or 3 times a day, that's amazing. But there's so much on their plate that, we let them get on. The only thing I would say about the first week is that if they do it when they're feeding, just make sure that you're not in too much of a slouched position. And I know that often women, for breastfeeding now, a very optimal position is to lean, is to recline and lean back. I would say that if you're going to practice your pelvic floor, we can see in the picture in the leaflet that we've got the train tracks, the folded towel. You just want to make sure that your perineum is not squashed by anything so that it's not sore, but also the pelvic position. If you are slouched and sitting on your tailbone, that might feel a little sore to do that way, but also it may actually, you need to be careful that it doesn't feel like a bearing down when you're activating your pelvic floor. So that's the only things I would say. You're probably better off sitting a little bit more upright when you think about those muscles.
Love it. And tell us about the train tracks. What are the train tracks? I love them.
So, so the train tracks is a tip that we all of us who worked in hospitals on the wards with postnatal women, we used to do that. It's just really making sure that there is a space in between those folded towels for the perineum and the vulva to not be squashed against a chair. And so you put those train tracks, I suppose, underneath your thighs, the back of your thighs, and that can elevate your perineum and your pelvic floor a bit. We do ask women to avoid the donut or the ring cushions, purely because the way pressure works, if you have a ring and you're sitting inside like on top of that ring, you're more likely to pull the edema, the fluid into the vulva and the labia. Do you agree with that?
Absolutely. Yeah. It puts too much pressure. And
okay. And also it's the same thing for, it's the same thing for hemorrhoids. We usually actually say, it's not a great thing for that as well.
Totally. And I had an episiotomy for my first, and back then it was still, but this is 30 years ago. So now we know more.
It's just, I mean, it might be, a lot of women say, when I sit on the toilet, it's wonderful. But actually, we know that sitting in a toilet for any prolonged period of time is actually correlated with also increasing hemorrhoids. So we know that circular pressure is not a good idea.
Yeah. Amazing.
Okay. So you just direct me where you want me to go next.
we'll move on to the next. What have you got next in the
Yeah.
leaflet?
So basically, these are all very simple. And again, as you can share this leaflet, there's so much information. I won't go through every single thing, but I think that a really, really massive one is actually here, bladder and bowels. Okay. So when we postnatally, both with a C-section and vaginal delivery, understanding that first poo that you go for, or even in those first weeks, some of the useful things that we have to do to reduce intra-abdominal pressure, and how to protect and help not to guard against a bowel movement. So I think it's pretty common practice. You can correct me, but to definitely reach out for stool softeners, because we want those stools to be easier to pass, right, immediately postnatal. But we want this position here. Can you see my cursor on the image?
Yes, we can.
Yeah. So we want this position here is the optimal position for improving the angle between the rectum, which comes here down through the spine, into the anal sphincter here. So when you sit in a squat-like position with knees higher than the hips, the back should be nice and straight, and then we need to try and use a good amount of breathing around that. So if you feel that you can feel the stool just coming down, if you have stitches, we recommend using something like a clean tissue, or even a glove or a pad, sanitary pad, to support that area where the stitches are, or even just the perineum if you don't have stitches, because you may feel that the perineum is descending as you try to open your bowels. So supporting it so that you can actually get a counter pressure to allow those stools to come down. Because I don't know if you can think about, like, if my fingers were the anal sphincter, and the stool is trying to come down, if the perineum is elasticated, still stretched postnatally, when you're trying to bear down, that perineum may come down with it. And so you feel like you can't actually get the stool out. So protecting and lifting, counter pressuring the perineum can actually make it feel more effective to get that stool out. The other thing is that whenever you have any stitches or the C-section scar, by supporting it externally, you may feel like it helps it not to stretch, and it feels less painful. I know it sounds counterintuitive to actually touch an area that has stitches, but if you use for a C-sec, in the leaflet, there will be a picture. We usually fold a little towel or use a little cushion to support the wound like this. And so when you're sitting in the toilet, you can actually support the scar, so that when you feel the urge to empty the bowels, you can actually support that area. Does that all make sense?
Absolutely. Monica, we have a question.
Yes, go ahead.
How long can I start working out again after giving birth? They say
Okay.
to wait until your 6-week checkup. Is that correct?
Okay, so yeah, so excellent. We'll go right into exercise. So
And
it depends.
make it relevant to both vaginal and C-section, because the next question is about C-section.
Absolutely, absolutely. So two things. It really depends on what kind of exercise we are talking about, and also it depends if there's any medical restrictions. So if the doctor has given you the all clear, then you should be able to go back to some gentle, gradual, progressive exercise, which should be low impact. And it should be something that you probably want to make sure that you don't feel any pain, and that you feel safe when you're doing it. And what do I mean by that? So if you haven't had a checkup with a physio, you just want to make sure that you don't have a significant diastasis that needs perhaps to have some support, or need some advice on that. Okay, so if you have a belly that by 6 weeks is still very distended, it's either sore, tender around the belly button, if you feel that you can't actually contract those muscles in and you still look significantly pregnant by 6 weeks, then I would highly advise you to see a physiotherapist to assess your diastasis. So that's number one, because it can just mean that you need to think about different exercises to do to begin with. If you have had a C-section, my feeling here in Singapore is that it really varies between doctors what they say. Some doctors by 6 weeks are really happy for you to go ahead. And then I see other doctors who actually ask women up until 12 weeks to do nothing, which I personally think is a disservice to women because that is way too late. And if we think about how much exercise women are doing at home, lifting car seats, putting baby in the car and bending, twisting, picking them up out of a cot, squatting down sometimes to get down onto the floor. These are all movements that are involving muscles, and they're not necessarily harmful for you. So I'm not sure if I've answered the question, but generally speaking, specifically speaking, the guidelines at the moment, as we understand in terms of evidence, is that 12 weeks, up until 12 weeks, we do not want to be really participating in high impact exercises. So in the past, women used to go to their doctors, have their 6-week checkup. Doctors would say, you are fine. You can go back to doing whatever you want to do as long as you feel okay, symptom-free, right? When we say symptom-free, we mean no pain, and as in no back pain or perineal pain, no urinary incontinence, urinary urgency, or fecal incontinence, flatus or wind incontinence, things like that, right? So if you're feeling symptom-free, then you can go back to doing whatever you want to do. However, we now have much stronger body of evidence to suggest that women wait until 12 weeks before they start doing high impact activities. So even if you are symptom-free, we highly recommend women not to jump, skip rope, run until they are 12 weeks. Now, that doesn't mean they can't do anything until then. There's a lot that they can do, and that will involve pelvic floor exercises, core strengthening, hip strengthening. So we start with glutes, with squats, lunges, single leg standing exercises to help build hip stability again, calf muscle strength. When we walk, we moving from brisk walking to running, there's lots of great things you can do, which means walking on a slope, walking uphill. So looking at those Fort Canning walks or Bukit Timah Nature Reserve, stairs, all to build up your hip and your leg muscles before we get going. And just to add, I know I've talked a lot, but just to add one reason why that 12-week point is important is because we know that by 6 weeks, your uterus has contracted, hopefully, and medically, you are pretty much well and healed if you have no symptoms. But we know that collagen, ligaments that support your uterus, your bladder, your rectum, actually take a bit longer to heal. And hence, that's the reason why, because we used to see, we think that many women who go back too early on to high impact activities can develop a higher incidence of prolapse and incontinence. So that's the reason.
I love that. And, I'm all about in pregnancy about preparing specifically for birth, because everything that happens in the pelvis and around it and the ligaments of the uterus and blah, 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 all of that needs specific addressing. And it does so postpartum as well. As you said, the hip, is our passage, right?
Exactly, so absolutely.
There, the sacroiliac joint, the pubic bone, all of that has to move to accommodate the baby. So it's
Yeah.
important to do special stability and strengthening exercises for those specific joints as well.
Absolutely. And so women who already are very fit during pregnancy, who have been doing strengthening, who have been doing yoga, Pilates, they will have generally a more stable,
Yeah,
stronger pelvic and hip area. And so again, consider that in those first 6 weeks, there's lots of things that you can go back to doing. And this is where the booklet will move into. One of them is establishing your breathing strategies again, because during pregnancy, your diaphragm gets really stretched out. So postnatally, the core becomes very disorganized in a way. And so going back to moving the diaphragm in a better way. So that means instead of just breathing up into your chest and
hmm
lifting those shoulders, which becomes very common during pregnancy because you're all squashed up, we want to get that diaphragm going through its full excursion. It's a big dome muscle. And when we inhale, it goes down. When we exhale, it domes back up. The more that muscle moves, the better your pelvic floor moves as well. So we know that we want to get that breathing better again. So I'll just quickly zoom through. The
yeah,
next set is just some very simple, and these are all exercises that you should be able to do postnatally. In this case, especially after a vaginal delivery. In
hmm
the C-section leaflet, we will talk about some of the exercises that are probably a little bit safer or less sore to do uh, after an abdominal surgery. But most of these, like for instance, on the left here, the head lift, we would
yeah,
not encourage this after a C-section. Okay, so
okay,
the C-section one would encourage a shoulder bridge because
yeah,
shoulder bridge will not stress the scar. It will
uh-huh,
help the glutes to get stronger, the back of your legs, and it also helps with sort of swelling, and it's a great way to decompress pressure on your low back. If you're especially post C-section, you tend to have to lie down on your back. It's harder to lie on your side
yeah,
immediately post C-section. So a shoulder bridge is a great way, and it doesn't have to be high. It's just even lifting your bottom a bit and tilting your pelvis a little bit can
yeah,
be a great way to move wind post C-section that stays in the abdomen and to encourage some hip muscle work. But these ones here on the right are great ways in the first 6 weeks to get some core stability. They're
yeah,
just control exercises. They're all very well explained, but if you have questions, of course, then
mhm,
you can come in and see us. But moving the spine, cat cow should be absolutely safe to do, especially if you do feel like you have a very significant distension of your belly. Again, if you do cat cow, it would be appropriate in the first 6 weeks to have some support for that abdominal wall so that you don't feel like it's really dropping down too much in an unsupported way. And for your C-section ladies, this might be something that you don't do to the full range of motion because
yeah,
it may feel uncomfortable, but you can do a small range as long as you don't feel pain.
mhm,
Um, yeah, but one other thing that I would like to add to what the discussion before about exercise and going back to exercise. Here's the thing that we highly recommend women to come for a pelvic floor check if you've had a vaginal delivery, certainly if you've had 2 or 3 vaginal deliveries, if you've had any significant perineal tears like a third or a fourth degree, which hopefully we don't see that many, but if you have, then please come for a check. But also, if you already have a history of having had some symptoms of prolapse, which will be usually a sensation of something coming down at the entrance of the vagina or a sense of pressure or heaviness in the perineum. So by 6 weeks, if you do have those symptoms, please don't ignore them and go out there and start running, even if you feel you're a very experienced runner. And the reason for that is what we can check, and we have really, really strong evidence to support why we do this, is that we usually do a measurement of the space at the entrance of your vaginal area, which it's basically with a little ruler on the outside of the perineum. It's not painful. We just measure the space from your urethral opening all the way down to your perineal body. Okay. And we call that the genital hiatus plus the perineal body length,
Okay.
which can indicate if you have a risk of prolapse. So if we know that you have, and it's quite common at 6 weeks for that measurement to be a bit wider because you've just
Uh,
delivered a baby and that area is still a little bit more
Gotcha.
gaping or stretched, right?
Mhm.
So we want to observe that measurement up until 12 weeks. So if that measurement by 12 weeks has actually contracted a bit more, which is what usually happens, we see the abdominal wall contracting and being
Yeah.
less distended. We see the genital hiatus, that opening of that vagina and the urethra and the perineal body contracting a bit. Then we can be more confident to say, okay, now you have a lot smaller risk of developing a prolapse, because when you're upright and you have a wider space, you have a higher risk of your organs descending. So
Uh-huh.
we just want to maybe check. And so if you come for a pelvic floor check, it is practice for us to look at women lying down. So we look at that vulva, we measure that space, but we also, for women who are keen exercisers, who want to go back to HIIT, who want to go back to running, we also make sure that we look at them in standing. And so
Mhm.
it's basically standing. It's not very glamorous, but women will stand with their legs wide open, and we will be on the floor like a mechanic looking under the bonnet. And we look at the vulva and we look at that space and we look at how the vaginal walls, and we have a touch with women's consent, of course, as to where that cervix is sitting inside of the vagina. So we can give a much more accurate guidance as to whether it's safe for that woman and at which stage to go back. So sometimes, if it's a second, third delivery, and that cervix is sitting a bit low at 12 weeks, we
Yeah.
may ask them to keep working for a bit longer on their pelvic floor, on their abdominal, on their intra-abdominal pressure, so that
Mhm.
they are hopefully not going to develop a prolapse.
Yeah. Amazing.
Yeah.
Okay. We have only got like 8 minutes left. I want to say here that I love the booklet because it gives you so much information too on how
Oh,
to
great.
take
Thank
care
you.
of your pelvic floor while you're changing your baby, breastfeeding, and
Yeah.
so on. So I think that's a really great help.
Yes.
I
Do you want?
I just had a fantastic question in the
Yeah.
chat that I think we should address because this mom is all about, how do I prepare and what can I do prior to
Okay.
startup?
Good.
Do you want
So
to
I'm
start
gonna.
sharing? The question is,
Sorry.
can you talk about the best way to breathe during labor, especially when pushing the baby out? In my first birth, I was told to hold my breath, but I'm not sure
Yeah.
that was the best or the right way. Monica, before you do that, stop sharing your screen.
Oh, okay. Sorry. I will do that. So here we go. Is that better?
Yes. Okay. I
Okay.
really love your take on that because I think that
Yeah.
is it's such a big issue here that they're always told, they always tell you to push in the same way, lying on your back, holding your breath, purple pushing,
Yeah.
and so on.
Yeah. So the evidence is not really out there significantly for us to make one decision one way or another. I think it's very much down to the individual, but I'm sure that you've watched enough births to understand that when it's a natural physiological birth, what many women do, and if they're left to their own devices, is that when you're getting to that really point of urge to
Mhm.
push, many women will actually hold their breath a little bit at the top, but then as they start to feel the urge to push, they will make noises and they will let that air, that pressure out, right? So it seems that if you're left women to do their own thing, that they will want to grunt, they will want to get those low sounds, they will want to kind of let the pressure, if you think of a pressure cook, they want to let that pressure out in some way. Now, what we do check with women when they're pregnant to see what for that particular woman is an effective way of getting that pelvic floor to open and bear down, because that's what we're really aiming to do. Because a woman could be blowing out, breathing out, or holding breath, but they might actually be contracting their pelvic floor up, which creates that resistance,
Yes.
right? So when we are with women from 37 weeks onwards, what we check is if, with their consent, if we can feel their pelvic floor. We have two fingers inside of the vagina feeling the pelvic floor, and then we ask them to just do what they think would be a good effort to push, and we see if they have a natural good ability to bear down on that pelvic floor. So that pelvic floor needs to descend. Now, sometimes they don't put enough pressure out through a breath out. And so
Yes.
we check with a breath, with a slight breath hold, and we see, okay, well, that worked well. Now, if that works well with the breath hold, can we now try it with that effort, but letting the air out a bit? So we kind of see where we can coach. Ideally, it would make sense to not hold so much breath. The problem is, I think, is when women are under an epidural and they can't feel what they're doing. So then they miss that physiological, natural
Yeah.
instinct of
Mhm.
the urge to push, right? And then on top of that, if they're on their back, it's not a naturally physiological position to push, right? So we practice in all different positions. We have a great benefit of having an imaging ultrasound. So we
Yeah.
usually put a transperineal probe on the perineum, and we see whether that perineal space can increase down with different efforts in different positions.
Yeah.
And what we have found, interestingly, that works really well is to try and blow a kid's party balloon. Often that creates a natural sense of bearing down into the pelvic floor if you release it. So, not that you're going to use that, but it can actually teach women the sense of the effort that they need to do to
Yeah.
open down into the perineum. And that involves a blow. So we need to have a strong enough, effortful blow to be able to get that perineum to descend. Having said all that, in a first delivery, our experience is that, and I'm sure, I don't know if you can concur with that, but the tissues can sometimes just still have more resistance. And so
Mhm.
sometimes you need to put a bit more effort. And that effort, sometimes in terms of getting that pelvic floor down, does involve partly perhaps a breath hold, but it doesn't have to be purple in the face. It needs to
Yeah.
be distributed in a way that your abdominals and your pelvic floor is opening down. So
Mm.
it's not as simple as just a breath hold or like an epiglottis closed or open. So we have to practice. I think that it's a really, really valuable thing to practice during pregnancy, those
Absolutely.
efforts.
And I think it goes to show everything that we do for labor, actually, whether it's relaxation or whatever. It
Mm.
takes, it makes a lot of sense to be practicing and not think that we can learn it in the moment, because I
Yeah,
feel in the pushing phase, it often takes a while to get the hang of it, to just
yeah,
understand what
yeah,
happens when I do this, what happens when I do that, and just
absolutely.
people also sort of don't think that they can use their core during pushing, which they very much can, even though
Yes,
muscles have moved out of the way.
yes,
But
yes.
disconnect, I think, is what most people struggle with, that the uterus contracts, but at the same time, I need to relax my pelvic
Yes.
floor. So getting
Yes.
feedback from a physiotherapist like you to see, so this is what happens when you're doing this, and this is what happens when you're doing that, and have a few different techniques, maybe.
Yeah. And it's amazing because it's literally like a light bulb moment when women try, and many times they see that they can't get that movement. Okay. What we look at with the transperineal ultrasound is we can see the image of the bladder,
Yeah.
the vaginal walls, and the rectum. And we want the angle of the rectum when you bear down, we want to see that length increase. And so
Mhm.
it's very visible. It's a quick biofeedback, and women can see. And when they practice one way and then another, and they go, oh, I see what you mean. And then they get it. And once it gets it, they kind of just know. But for those women who, I totally understand, things are expensive in Singapore, and going for an appointment, sometimes it's just not feasible to pay all the fees. So one quick way, just as a tip, is if you put your fingers on your perineum, and I know when you're heavily pregnant, that's maybe not so easy. So perhaps even straddle sitting a bolster, or even
A
straddle
rolled up
sitting like
towel.
a soft ball or a rolled up towel, and sensing your pelvic floor, sensing your vulva and your perineum. And in that position, which is already very good because you're slightly kind of, you're sitting, you're upright, and you have gravity, is to practice blowing. And one way that you can do is you can try just blowing out, breathing out, making low sounds, and sensing, does my perineum come down to that surface? Or if you need to add a little bit more oomph, a little bit more effort, you can close your hand and blow into your hand and sense, can you feel your pelvic
Mhm.
floor open down to that area? Okay. And the other thing is you can try blowing a balloon and sensing again as well. Can I feel my abs making a general effort to press and push that perineum down?
I love it. Amazing. I
Yeah.
will share that in the pregnancy group and always in the baby group. It is important even for your next baby. So I'm
Yeah.
glad that we have this. We'll post it on YouTube later. And so I'll share all the content with you. And then for those mummies who do want, or parents who want those booklets. So there's a pregnancy
Yes.
one, there's a C-section one, and there's the postpartum one after vaginal birth. Are you happy for me to distribute them?
Absolutely. Absolutely. The more the merrier. This information should be
Amazing.
absolutely reachable to everyone. Yeah.
Amazing. So I'll post a link under the video, and then
Yeah.
people can access it on my Dropbox, and you can download it from there,
Yeah.
or I can send you a WhatsApp if that is easier. We've
Yeah.
Cindy saying that is so amazing. Thank you so much. And really, thank
Okay.
you so much. You're so generous with your time. You're so generous with
That's
this information.
fine.
And I'm
I
so
love it. I mean, we all have to do something that feels meaningful and helping. And to be honest, I come from a national health service background. I feel that health education should be universal. And we live in Singapore, and it's private practice, but I highly, highly reach out if women need that, they should just appeal for help. Yeah, with that. I have to say just really quickly that we see over and over again women who have come even for one session at some point in from
yeah.
34, 35 weeks during pregnancy, who have had all this information. They come back and they always say, it was so helpful. It helped me to understand the pushing and to understand the effort. And if they have good doulas and people there to support them, it's really the way forward for us to minimize and reduce unnecessary perineal trauma. Yeah.
Yeah. Amazing. So Physio Down Under, you can book Monica, Tamara, all your lovely Alex. You have seven, you said,
Yeah.
right?
We
Seven.
have we have seven of us now. Rachel Druce has just joined us. She's a very experienced clinical Pilates a person. We have a beautiful Pilates studio with classes for moms and moms with babies and pregnant women. So we are all about making women feel strong and powerful. It's not just about light exercise. We lift weights. Like women have to get strong. We are
Absolutely.
not fragile during pregnancy or postnatal. But we have to do it safely and with precautions. Yeah.
Amazing. So you can find them at Valley Point, and I will post the details on the under the YouTube video as well. So thank you, mummies, for
Wonderful.
joining us on the call. Thank you for if you're watching this at a later stage. And thank you so much, Monica, again for your time. And I hope we can speak to you again soon on another topic.
Absolutely. Thank you for organizing this
Thank
and
you
for
so
having me.
much. Okay, bye.
Bye.